I'm here with Dr. Walter Patrick, professor at the University of Hawaii and Secretary General of APAC. My name is Yasin Chalikov. I'm from the University of Montreal, and we'll just be having a small discussion here. So, Dr. Patrick, I know you're involved in global health education, and since I'm a student, I personally would like to know if you think that it should be mandatory for medical students to have some exposure to global health in order to be better practitioners after.
It's a wonderful question, Yazin. Good to meet with you. Mandatory is a bit of a strong word in teaching medicine. Yes, I think it should be the core of some of the values that we teach for health. Global health is really a health of concern for humanity. And therefore, as a physician, we should be involved in looking not only about the neighborhood around us, but the larger neighborhood and the world, in fact. So it's very necessary for medical education.
Okay, I know you have experience. You've traveled in many countries and worked within medical-related fields in those countries. Do you think that such experience is important for all doctors, or to be better practitioners in their home country wherever they're located, or is it necessary just to have a few people working in that area?
If you want to bring about change in something as vital as health that transcends countries and boundaries and neighborhoods, I think it should be something that is needed for all of us, all the doctors, and not merely a specialized group that does infectious diseases or some small things like that.
I understand. Thank you. So, Dr. Patrick, in your talk here, you talked about how altruism should be put forward when developing policies of global health, and how opportunism should be put aside. Now, given that we live in a capitalistic world, which is economy-driven, profit-driven, how do you think that personal values can be incorporated in international and national policies?
Personal values are the ones that drive most people, even most institutions and most countries. It's the leadership that does that. It's the thing that drives families and mothers to take care of their children. So it's the core value in all our lives. Opportunism is necessary to make altruism happen. And so they are not mutually exclusive. It's how we balance those two things to the good of humanity that is important.
I understand. So you participated in the panel about institutional alliances during the conference here. I would like to know if you think that institutional alliances are currently set up at a very effective way, or if they could be improved, and if they can be, what are effective measures of improving them?
Institutional alliances are very important, Yasin. It's very important in bringing people together and actions more cohesive. But the leadership and the power of institutions need to be balanced. At the current state of affairs, the North groups have the leadership and the resources, and therefore seem to have their agendas more in place, however good they are. So there needs to be a balance in the alliance structures of leadership and power. And then we will have a better effectiveness in getting the things that we want done.
Thank you, Dr. Patrick.
Aloha. Good luck in your studies.